Frontline healthcare workers are stretched thin as the COVID-19 hospitalization rate continues to climb here, but they're still showing up doing the best they can. KFTM's Jillian Ferdig talks with a doctor at Altus Lumberton Hospital.
So kind of tell me a little bit from your perspective, what's going on out there as far as on the front lines? You guys have a ton of patients there at Altus right now, I know.
Yeah, so Altus is a very interesting location, kind of especially serving the community where it all kind of filters down, from the north side of us, that they have to go through us before they get to Beaumont, of course.
Mm-hmm.
So a lot of people just can't make it the extra 40 minutes, and this, what we're seeing with COVID now is this resurgence, of course, with what everybody's calling the Delta variant, right?
Mm-hmm.
And the biggest thing about it is how fast it infects people. Okay. We started to get ahead of it when people started to get vaccinated. And then now with this new variant, it just got better at its job. It's getting you significantly more sick by day 2, 3, and 4. And therefore, by the time that you come in, you're getting all those serious consequences of shortness of breath, unable to breathe, chest pain, and needing more supplemental, oxygen and things that high acuity centers have. Patients are needing significantly more workup and more help in the oxygen sector. And unfortunately, it's overwhelming the hospital system.
Yeah, and for you guys there, I'm sure you get patients that maybe need to be transferred like ICU, or that, they need more critical care, and that there's challenges right now because of bed space. I mean, how is that looking from your perspective?
Unfortunately, it's, there's some people that are staying here that needed an ICU bed for over 6-7 days. I mean, everybody's doing their best. Doctors are willing to take on patients, but we just don't have them. And it's also understanding that, whether it's in the healthcare or non-healthcare field, people are getting diagnosed with COVID, and some of those are nurses, some of those are techs, and therefore they're closing down sections of hospitals because they can't staff them. I think what's important is to remember that the vaccine is not saying you can't ever get it. You just won't need hospitalizations for the most part, right?
Right.
And I think that's the true message that we need to get out. Individuals need to understand that it's not a cure, but it opens up hospital beds for the rest of the population that need it. It's doing your part for the community, because now without this vaccine, people who normally wouldn't need to be in the hospital, it's your grandmother, it's your mother with a heart attack that was vaccinated without, COVID, can't get the treatment that they need for heart attack or for cancer. So it's a significant trickle that's happening, that it's affecting the healthcare industry in ways of just COVID. That's not the only issues that we're having.
For you guys, I mean, there's probably patients that, you'd like to transfer, but like you just don't have a choice. So you guys are just having to keep them at this point, right?
Exactly. And we're doing our best with everything that we can. We've hired more staff. We're not necessarily hired. We're bringing in more staff. People are doing double shifts. We're doing everything that we can. It's just not a normal day for us here, because the volume is so high that we need extra hands. We may only have a significant amount of rooms, but all the patients are requiring almost one-to-one care because people are very sick. We're tired. We do love our job, but the long-term effects is that we're really just kind of demoralized with the inability to help as many as we want to.